Around 45% of the deaths in Europe is related to heart diseases, and worldwide it's around 30%. So actually we really have a very strong reason to help there. And we know that around 80% of all those deaths could have been prevented if we would have known the risk early and people would have taken action upon it. So the question is, can we do something about it? Our project is helping to improve existing risk models. We collect lots of data from different sources. We develop AI and machine learning-based methods to try to see if we could find new measures that taking into account that they really should cover all kinds of populations, and then implement them in actual software that a clinician could use in clinical practice. All of us are different, and that's really a challenge if you compare how to apply AI in cars or industry. If you have machines, you can easily copy thousands of algorithms for thousands of machines if they are all the same, but you and I are very different, and what is a normal heart rate for me might be low or high for you. And sometimes certain measurements might look unusual, but if a certain person is taking medication or has a certain background, then it's actually normal. So actually you need to really say, okay, we have a certain risk assessment that is especially useful for you. And it's very important to have actually that international component added to there, because countries are, of course, by definition, only a small part of the population, and there are certain processes and certain ways of treating patients with certain healthcare systems that are pretty specific to countries. And of course, then there is the background that there is also genetic background. Lifestyles are really, well, region-specific at least. So if you want to develop something that is valid for the wider population, it's really essential that you cooperate among borders and really try to take into account the larger view of having more data, but also from more different backgrounds. Well, it really has opened more things, and what we couldn't have done if we would have just stayed with in our case, a Finnish database. Of course, we could have done something, but it would have been quite marginal. Well, you could have said, okay, this works for the Finnish population, but then so what? How does it actually then is meaningful for the rest of Europe or the world? So that's certainly an important thing there that we added. And of course, then also the new contacts that we get, the new network that we are building, the experiences. So they are really important things also for looking at the future. So now we have this project running, but we have already together applied for other projects and are thinking about how to continue after that. So it's a nice network that you are building, and then over the years will give more results.